Hello again, folks. Mike Grogan back with another edition of Integral Trends, our ongoing series on the trends, dynamics, and issues that affect how we lead and plan within our nonprofit organizations. Today, we're going to talk a bit about an issue that I think has been percolating, certainly over the last couple of years as we've worked our way through COVID. The idea of having a workforce that's struggling with its mental health and well-being was a new issue we started to see throughout the pandemic. Some work being done by ABNN, Imagine Canada, highlighted this issue early on in the pandemic, and I think we're starting to see that it's maintained its way through even as we start to head towards recovery. And as we look sort of towards longer days, spring is here, things are starting to look a little bit more like normal, and we're starting to plan to the future. There's perhaps a bit of a caution here for us. We need to take care of some internal issues before we can move forward with getting back to the way things used to be. So the question I have for today is, how are our staff and volunteers doing as we emerge from COVID, as we emerge from the pandemic? And have we sort of getting that sense, are we starting to get that sense of burnout? This is something that the entire workforce across all industries is starting to feel. Some data from Abacus coming out last month was that over 34% of those working right now are feeling burned out. But surprisingly, or perhaps disappointingly, within the nonprofit sector, the rate's much higher at about 43%. I don't know if that's really necessarily surprising. The work that the nonprofit sector has done over the last 2 years has been nothing short of heroic. From those organizations that have been on the front line and keeping services going, to even organizations that had to step back a bit and to maintain their work without having perhaps the ability to run. So the stress is built up, and we're seeing that for many in the workforce, that sense of burnout is settling in. One of the challenges with burnout, though, is that the impacts sort of ebb and flow a bit, and many of them are hidden. Some things we can see: increased absenteeism, perhaps more reliance on EAP programs if organizations have such things, perhaps that sense of quality of work and performance at all levels. This is not certainly a frontline thing. This is right up to senior leadership. Is performance starting to suffer? And some of those things we can see, but many things we can't see. And these are the things that are more nuanced part of burnout, and ones we're perhaps not even aware of ourselves. That engagement side of things, the energy, in some cases, civility. We're not quite the same way we were with each other in the past. And is that part of the burnout piece? It varies from person to person, varies from time to time, but it's not just one trait or one symptom that we can see. It is certainly a lot of different symptoms and traits in terms of burnout. And so maybe the question we have to ask ourselves is, as communities start to recover and the economy starts to take off again here in Alberta, do we need to restore some things before we can fully move forward? Is there some foundational work to do for nonprofits to make sure that we do have the capacities to do all the things we want to do? There's a lot of pent up energy sometimes in the sector. We've been waiting for years, a couple of years now at least, to get back to normal. And before we go full speed, there's maybe a bit of a whoa to sort of ask ourselves here, or to caution ourselves with, before we embrace that fully. So some things we need to think about, perhaps. I think that one of my favorite quotes is, all change begins in conversation. And as we think about restoration before we move into recovery, perhaps we need to have those conversations. We need to talk to each other. Not necessarily easy conversations, not necessarily ones that are going to come the first time around, but as we talk to each other, have those conversations with our staff, with our peers, with those we work with, I think there are some places we can start to name what is strong and where we also need to build our capacities back up again. We need to adjust our expectations. Our plans and moving forward, I think, are starting to take off here and ramp up. We're certainly seeing that in IntegralOrg, but maybe we need to adjust some of those plans and say, okay, before we go full speed, do we need to take a look at ourselves first and see where our capacity is really strong, and where do we need to sort of step back and heal a bit before we move forward? And we need to take care of ourselves. This is perhaps something that is harder to do in the nonprofit sector. The nonprofit sector is so well versed at taking care of others. This is the strength that we have. We do for others quite easily and quite readily. But to do that, we need to be in a strong place ourselves and not always giving and giving and giving. So how do we step back? How do leaders step back? How do people in front line positions step back and take care of themselves so they can go forth and do all the great things that nonprofits do? Thank you, and we shall see you again on our next edition of Integral Trends.